How about another subject that might get you going? COVID. It seems that COVID has disappeared from our daily life, but experts are warning that apparently we are flying blind about how infections could play out this coming winter, this autumn.
Yeah, and they've also warned the decline in surveillance of new variants could put extra pressure on the NHS, cases increasing across the country.
Joining us now from West Yorkshire is data and COVID expert Tim White. A very good morning to you, Tim. Do you agree that actually we are sort of flying blind into what could be another crisis?
Good morning, both of you. Yes, I do, to be honest, Dan. There is a distinct lack of monitoring, so therefore a distinct lack of data. There's just pretty much circumstantial evidence, and we can track hospital admissions. We don't really know how deep COVID is running or will run in the future. And I think another good point is that we don't have enough data year on year. It's still a very new disease in medical terms, and therefore we cannot say with certainty the sort of things that we can about flu, and we can make quite a good projection of how many people will suffer from flu and how busy our hospitals will get. And the fact that COVID has gone down in the headlines and all the restrictions have been eased, of course, including in that many people won't realise is that we are just simply not doing the depth of research that we used to do, the monitoring. As I say, the Office of National Statistics used to give very good figures about how many people were infected. And from that, we could extrapolate how many people would become very ill and how many people would need serious care in hospitals. And it's all to do with trying to ensure that our hospitals don't have another crisis this autumn and winter, as you suggested.
Yeah, Tim, it's important to maintain a sense of perspective when we talk about things like this, because, of course, COVID gets everybody scared again. When we look at the average deaths at the moment, it's very low, 63 the last 7 days, and that's with a 26% decrease week on week. So it's good to be mindful, but we don't want to get into the realms again, do we, of like scaring the bejesus out of everybody.
No, absolutely. I think it's important to say that. I think this is pretty much a debate that's being had by experts, and some of the newspapers may jump on it and say, try to cause some hysteria almost. But you're absolutely right. It is still a disease, and it will still kill people, as will flu, as will a lot of other things. But there isn't a pandemic. What we do worry about is, as has been said for, 3 years now, and maybe we'll be talking about this subject for the next 10 years as well, the possible emergence of new variants. And it is important to find those early. It is important to find out whether the vaccines that we have work. And the big unknown coming into this winter is a lot of people probably won't get another booster. We'll just think that it's gone away now. And will that contribute to a rise, and a dangerous rise? But we're not talking about, thankfully, the likes maybe of you and I or most of our viewers, but it's the most vulnerable, the very elderly, those with compromised immune systems or comorbidities. But yet at the moment, it is at a very low level. We have to say that. But when schools go back, when colleges go back, when people return after summer holidays, having done a lot of mixing with other communities abroad, often that's when we could see the biggest rise. And as people start to mix indoors more and more, as we say goodbye to this glorious summer that we're all enjoying right now.
Yeah, absolutely.